course, at least 15 years ago, my son had a skin issue, and I had taken him to a couple of different doctors, and nobody could give him the proper medication or figure out what was actually happening with his skin. So finally, when I came here, within minutes of seeing him, she was able to diagnose what was happening with his skin, get him the things that he needed, and ever since then, I have been super loyal, and I send a lot of clients here. She's been amazing to me and my family and my boys, and I just love my experiences with her.
So I wanted to just like kind of chat with you and talk about your experience with the microcoring. And I've had the microcoring as well, so we can kind of share our little like our feelings about it. For me, when I did the microcoring, I've done it once, and I did my neck and I did my lower face, and I felt like the neck really got tighter. Like when I touch my skin, I can feel it's actually thicker. I like to combine the microcoring with like biostimulatory fillers like Radius, and also like stem cells. We do stem cells, and I also like to combine it not so much with sculpture in the neck, because I think the neck is too thin, because you can sometimes feel the sculpture. But and then on the face, the interesting thing for me, and I don't know if you've noticed this, is that my nasolabial fold was effaced, which means it just basically got less deep looking. Because when you do microcoring out here, it actually flattens it so it looks more youthful. Did you notice that?
I noticed it really a lot through here, and through I started to see some lines coming through here, and it really, I would say there's like a 50 to 70% improvement just along the sides here. And then I had some little concerns starting to happen along this part, and when you did that, I had really good results from it.
Did you find that your skin feels any thicker? Like,
it felt, for me, right after, within a few days, it felt a lot more tight. I could feel the difference, and clients noticed the difference quickly.
Okay. So one of the things I like about Ellacor is it fits a gap in skin rejuvenation, because it actually takes out little pieces of skin, so we actually know that we're going to get some diameter shrinkage, and so that kind of makes it very unique. And I think that patients that have tried other things and they're not quite ready for surgery, they don't want to have incisions here or the risks associated with surgeries, they're a great patient for that, because they are trying to get improvement that won't have any telltale signs. Because even if you do incisions, and very subtle and discreet incisions, you still see fine lines. They're like blue jeans, they fade, but they don't go away. And on the neck, I think it's especially helpful, because the neck you cannot do, you can't be that aggressive on the neck with lasers. And so this device enables us to thicken the skin and tighten the skin. And then I'm also excited we're starting to use it on the abdomen for the laxity of the skin. And I think that's going to be very promising, because around the belly button, all that skin that gets very thin from having babies, and gaining weight or losing weight, it helps thicken the skin and tighten the skin. And I think that's going to be really exciting as well. So this is a treatment that can help kind of reset the skin clock, and the way it works is it actually creates new collagen and does this kind of wound healing thing that's scarless, because you're taking out little pieces, but it almost does like the kind of wound healing that you have in utero. So in utero, if you do a little biopsy or take a little piece of skin from the neonate up to a certain age, you get scarless healing. So there's something magical about certain types of collagen, and this kind of stimulates that kind of collagen.
I'm very much looking for that.
Yes, that little reset. That reset. And the microcoring is is good for, I think the demo is, somewhere between 30 on up. And sometimes the younger the patient, they can see that they really notice the changes in, like, sometimes more, because they don't need a large correction. So they don't need a facelift. So I find it's great for patients before they need a facelift, or after they've had a facelift and they may want some tightening. Some of the things I'm doing too is I'm doing, like, even in a facelift, I'll just do around the mouth and like here, just to face some of this to improve that, so you can mix and match. And also sometimes I'll do laser on the face and I'll do microcoring on the neck, because on the neck you can't do heavy aggressive lasers. And you can do other things, like you can do microneedling, and you can do RF microneedling, which is microneedling with heat. But the thing about this is I think it goes for the neck for me for tightening, which I'm excited to see if you like it, because we're going to talk to you afterwards again, when after you've had a couple of months of seeing it all tighten. I also feel like you get tightening for 6 months. Like, I think the changes keep happening for 6 months. So, but with the neck, I think it goes like this. It's like, a light laser, microneedling, RF microneedling, which is a little more aggressive, and then microcoring. So of all the devices for tightening that are non-surgical, I think the microcoring is the most effective. So, the studies show that I think about 60% of people do 2 microcoring, and that actually, you just build on your tightening and you get even a better improvement. So 40% do 1, and some doctors, including myself, will do microcoring and then maybe follow it up with some sort of fractionated resurfacing procedure to help also. So, like, there's a lot of mixing and matching. So I love the fact that we get to do your face again. It's so interesting because that we lose collagen as we age, and so we're trying to replace the collagen that we're losing, and it depends on how quickly you lose collagen. But we know from I think from studies with Ultherapy, which is it's a sound wave treatment, right? That one's a really great treatment. I have seen the best results with Ultherapy when you combine it with a filler like Radius or Sculptra, and you do it like once a year or once every 2 years. I don't know what microcoring, because it hasn't been around that long. We've had it in our hands for about a year, but I think that it really depends on the person. You can, I can feel my neck and say to myself, well, do I think I need more? Do I think my neck needs to be tighter? Do I think it needs to be the skin thicker? Then if the answer is yes, then I would do more, But I think you could potentially do it like once a year, but I don't think you're going to need to do it that frequently, and I don't think you need to do that frequently. It depends also what part of the age cycle that you're coming in. Like someone like me versus you, I theoretically would need many more treatments than you, but truly, silly girl. But it's true. Yeah, I think it's something you just kind of we're gonna have to see, basically. So everybody has a range of how quickly they heal. And I was wondering, how long do you think it took you to heal? And there's 2 healings. One is where you felt like you could go out in public with makeup, and then the time in which you no longer had any redness.
So so I went right back to work the same day I had it done. And so I shared my experiences with my clients that came in and let them know what
you
was
went
happening.
When?
That day I had it done. I went right back to work.
Oh my God.
Yes, I did. I did. And so I shared it with everybody who was walking in, and they were like, what happened? What did you do?
Right.
And I shared it. And then I worked the next 3 days, and then I had 2 days off. I would say for me, by the 7th day, I still had a little bruising, but we did a little bit of that V-beam on there, which really, really helped. For me, like within 7 days, I was fine.
Okay. So you healed really quick.
I did.
Yeah. So you're a fast healer, and part of healing is, do you take anything that makes you bleed or bruise? You don't. But we try not to have patients do any of that beforehand. No fish oil, no aspirin, no Advil, any of those things. But some people swell more. Some people are swellers, just intrinsically in their bodies, they tend to swell. And some people get red longer. So, I'm a sweller. So I'm the worst case scenario. I call myself the other side. I'm the outlier on like the longest to heal. And I felt like it took me about a week to look pretty good, the swelling go down and everything, but it was like I was working also, but this is what I do, so people are used to me walking around looking funny. But it took, I think, a week, and then I was pink. I had pink dots, because we also did an aggressive treatment on me, and also on you. We did 8%. You can do density from 5 to 8. But it took me, I would say, 12 weeks. The equivalent of laser resurfacing, and I had like little red dots on my, not so much on my neck, but on my face. And so it took me longer. So I'm way on the outlier scale, like that's unusual. So I tell people when they have the Ellacor, I feel like it's a lot like laser resurfacing when you do an aggressive laser, where you can be pink for up to 12 weeks, but you'll be less pink each week. But most people are not pink that long. Some people are pink a week, 2 weeks. I've heard 3, even 4 weeks, but like 12 is very on the outside. But I like to tell people so they don't, they know what to expect, that that's a possibility. Because everybody kind of, responds differently.
Yeah, because I think I had a little bit of the dotting for probably 2 full weeks.
So 2 full weeks.
2 full weeks of like the dotting,
Yeah.
but I could cover it with makeup really easy. Because it wasn't so much up here, it was just a little bit around here.
Right.
And a little bit of swelling was on the lip part.
Right. So, Michelle, sometimes people ask, actually they don't ask me necessarily, but they want to know, why would I come to you, like to me, for a procedure or a treatment or something like that. And what I tell patients is that all I do is study. Like, it's crazy, but I study all the time. And what that means is in the last 3 years, I've gone to like 5 very premier, granular anatomy classes. And what that means is I've trained with the best people in the world, not only in anatomy, but also on ultrasonography of the face, which is really important. You can see fillers, you can see how deep you are with your microcores, you can tell depth of things. You can see muscles versus glands. It's such a great view. It's like an underwater view of the skin, and that helps tremendously. Like, I can look and close my eyes and I can see every layer of the skin, no matter where I am on the face. Like, I can know what's all there, layer by layer by layer. And I was training a fellow, and I was like, it's all about the layers. The most important thing about what we do is understanding the layers. And why is that important? Well, with microcoring, I can do the microcoring, but then on a different layer, I can do the 1927 laser, or a different layer, I can do a filler. And as long as I know my layers and where I am, not only is it for safety, to make sure that I'm not going to put the filler somewhere that's going to hurt you, but it's also for best outcomes.